Okay, today we're talking about a drug that's a total game changer for folks with hemophilia A. It's called HEMLIBRA. And I mean, it's a massive leap forward. But, with big breakthroughs like this, there's often a catch. And this one comes with a brand new set of rules that are, well, they're not just important, they're absolutely critical for everyone to get right.
Just think about this for a second. Imagine living with a condition where your blood just doesn't clot the way it should. Life is a constant cycle of tricky injections, and you're always worried about a serious bleed. So, what if that could all change? What if managing your condition became a simple, routine thing you could just do at home? That's the promise of what we're looking at today.
All right, let's jump right in. We're going to look at the challenge and the solution, a whole new approach to hemophilia A. So, what's really going on with hemophilia A? Well, at its core, it's all about a missing protein. It's called factor VIII, and you absolutely need it for your blood to clot. If you don't have enough of it, your body just can't form those good, stable clots. And what that means is bleeds can happen way more easily, and they're a lot harder to stop. That's the daily reality for so many people.
And that's where HEMLIBRA steps in. The fancy name is emicizumab, but here's the really cool part. It's not a replacement for that missing factor VIII. Nope. It's something called a monoclonal antibody. You can just think of it as a smart, lab-made protein that's designed to mimic what factor VIII does. So its job isn't to stop a bleed that's already started. Its main goal is to prevent those bleeds from ever happening. And this is why HEMLIBRA is such a big deal. First, it's prophylactic. That just means you're not playing defense waiting for a bleed to happen. You're on offense, actively preventing them. Then there's the injection itself. It's subcutaneous. That's a huge quality of life thing. It's not a difficult IV into a vein. It's a simple shot right under the skin. So much easier. And finally, you get these stable levels in your blood. You're not riding this roller coaster of protection going up and down. It's a steady, constant shield.
Okay, so we've seen the incredible upside, right? The breakthrough. But now we have to talk about that catch I mentioned, because the very thing that makes HEMLIBRA so effective, well, it also creates a new and really serious risk if it's mixed with some of the older meds. So this is where we all need to lean in and listen really, really carefully.
So HEMLIBRA is amazing at preventing bleeds, but what if one happens anyway? A so-called breakthrough bleed. Your first thought, your instinct is probably going to be to reach for those emergency treatments you've always used. But here's the thing. On HEMLIBRA, that instinct could be seriously, seriously dangerous.
And this isn't just my opinion. This quote is pulled right from the patient's safety guide, and it couldn't be clearer. If you use a specific type of bypassing agent called APCC, you probably know it as FIBA. While you're also on HEMLIBRA, you're looking at a potentially life-threatening situation. It's like the two drugs together can push the body's clotting system into complete overdrive.
So what does overdrive actually look like? Well, it can cause two really, really bad conditions. The first one is thrombotic microangiopathy, or TMA for short. Think of it like this. Tiny little clots start forming in your smallest blood vessels, and they can start wrecking your organs, like your kidneys. The second is thromboembolism. This is when larger clots form, and they can block major blood vessels. And that can be a life-threatening emergency, no question.
So this is the key takeaway here. The old playbook, you gotta throw it out. There's a whole new set of rules. Rule number 1, you have to stop any prophylactic bypassing agents the day before you even start HEMLIBRA. Rule 2, you avoid APCC, that's FIBA, at all costs, unless there's literally no other option. And rule 3, if you absolutely have to use it, you follow a new, much lower dose that your doctor gives you, period.
And that brings us to the one number you absolutely have to burn into your memory if FIBA is the only option, and that number is 100 U per kilogram. Let me say that again. That is the maximum total dose allowed in a 24-hour window. It's the absolute limit. Going over that number sends the risk of those dangerous clots we just talked about sky high. Think of it as a hard stop, a red line you just do not cross. Okay, so that's the big, critical drug interaction. But there's another catch, and this one's a little more subtle, a little more sneaky. It has to do with what happens when you go to the lab to get your blood tested.
See, HEMLIBRA is always in your system, always working in the background. And because of that, it can actually fool some of the standard lab tests. These tests are looking for clotting activity, right? Well, HEMLIBRA is providing that activity, so the test gets a false reading. It looks great on paper,
but the result is inaccurate, and that could lead a doctor to make the wrong call. And this is basically the cheat sheet. On the left side, you see the tests that HEMLIBRA messes with, the ones you can't trust anymore. And on the right, you've got the tests that still work just fine, that give a true reading. It is so, so important that any doctor, any lab, any healthcare provider who sees you knows which list to look at. It's absolutely crucial.
So, okay, we have this serious drug interaction on one hand and these unreliable lab tests on the other. That sounds like a lot to manage. So how do you navigate all this safely? Well, that brings us to our final section, your safety toolkit. And you know what? The most important tool in this whole toolkit. It isn't a fancy app or some high-tech device. It's simple, it's low-tech, and it is absolutely essential. It's your patient alert card. This little card has everything we've just discussed, all the critical info, right in one place.
Now, this card comes with a few non-negotiable rules. You have to carry it with you at all times. You have to show it to any healthcare provider you see, and I mean anyone. Your dentist, the nurse at urgent care, the pharmacist. And check out that last point, because it's a big one. You gotta keep this card for 6 months after your final dose. Why? Because the drug is still in your system for that long.
When you really boil it all down, it comes to this. With a medicine this advanced, this revolutionary, communication is every bit as important as the medicine itself. The drug is amazing, but it can only do its job safely if everyone, and I mean the patient, the caregivers, and every single person in a white coat, is on the same page about these new safety rules.
And that really leaves us with a bigger question to think about, doesn't it? HEMLIBRA is a perfect snapshot of the future of medicine. It's powerful, it's targeted, but it also comes with a new, more complex instruction manual. So as the chemistry gets more and more incredible, how do we make sure our communication keeps pace? How do we make sure these critical new rules get to everyone who needs them every single time?